We advise members of the public to avoid all processed meat products that are sold as ready to eat. While we know that polony is definitely implicated, there is a risk of cross-contamination of other ready-to-eat processed meat products, either at production or distribution or at retail. This is because Listeria monocytogenes on the exterior casings, that means packaging of polony, can be transferred to other products it comes into contact with, including Viennas, Russians, Frankfurters, other sausages, and other cold meat products that are typically not cooked before eating. Listeria monocytogenes was isolated from over 30% of the environmental samples that were collected from this site, which happens to be the Enterprise factory in Polokwane. To conclude the investigation, whole genome sequencing analysis was performed from this Enterprise factory, and the results became available midnight last night. The reason that I called you here is because the NICD woke me at 12 o'clock last night and told me that they've got results from the Enterprise facility, and that the outbreak strain ST6 has been confirmed in at least 16 environmental samples that were collected from this site.
What we do is when the bacteria are isolated, either from the patient or from food itself or from a food production environment, we then conduct the specialized genetic testing. It's a DNA fingerprinting called whole genome sequencing that allows us to compare the bacteria and ascertain with a great deal of precision whether they match exactly. So in that way, we can be certain that we have an outbreak strain in patients that are being ill and then match it to a food or food environment isolate. And it confirms if we have the presence of that outbreak strain in people who've got ill, as well as food that has been consumed by people who've got ill, as well as from the environment where that food is being produced. It's conclusive evidence of the source of the outbreak.
As of the 2nd of March 2018, a total of laboratory confirmed cases have risen to 948 cases, still as we're counting from January 2017. Of these 948 cases, we've been able to trace 659 patients, and unfortunately, 180 of them have demised.
What has been done so far this morning after the results were received, we issued the 3 manufacturing facilities with a notice in terms of Section 62 of the National Consumer Act. Those facilities are the enterprise facilities in Polokwane and in Germiston, and in the RCL Volvohout facility in Sasolburg, Free State. Those are the 3 facilities. So they've received those notices this morning. The next step then is it is the responsibility of the company now to come up with a plan to recall all the products from those facilities. They will then meet with the National Consumer Commission, which we hope will be tomorrow morning, where they will then submit this plan for recall. The NCC and the companies concerned will then ensure that this plan is sufficient to cover the entire distribution chain to ensure that all these products are recalled, and then secondly also notices are then issued via the media to consumers as well who have purchased those products, what to do with those products that are already in their fridges.
There may be concern by members of the public who have consumed these products, and we would like to issue a reassurance that the vast majority of people who have consumed these products will in fact be fine, and that if any infection occurs in the vast majority of people, it is asymptomatic and there is absolutely no need to worry. The few persons who have consumed these products who have risk factors, as the Minister has pointed out, namely pregnant women, persons who are living with HIV, and persons who have other underlying immunocompetencies or immunodeficiencies. These persons, we have consulted with international experts, and we have reviewed the literature, and the guidelines are that if someone has consumed these products and they have one of these underlying risk factors, but they do not have symptoms, in other words, they are presently well, that they should not be concerned, and if they are concerned, they may consult their general practitioner.